Namaste students, my name is JVN's Dr. Neeraj Dholia, Faculty of Agriculture and Veterinary Science, Jayoti Vidyapeeth, Women's University, Jaipur. So in this lecture, we are going to discuss about the disease pneumonia. And this belongs to the subject medical biotechnology. So let's start. So basically pneumonia is the lung infection, or we can say the infection in the lung. So that is known as the pneumonia. So it inflames or it causes the inflammations in the lung and in the air sacs in one or both lungs. So the air sacs may fill with the pus or causing the cough with bulgum or pus, and fever, chills, and difficulty in breathing are the common symptoms for the pneumonia. So pneumonia is it is not caused by single microorganisms. So the causes are diverse. So the pneumonia can be developed from the bacteria. It may be the bacterial pneumonia, viral pneumonia, or fungal pneumonia. So the common signs and symptoms of the pneumonia are chest pain, cough, which may produce the bulgum and shortness of breath. You can feel the fatigue and severe sweating and shaking, chills. The fever may be there, and lower than normal body temperature in adults older than age 65 and people with weak immune systems. Nausea, vomiting, and diarrhea, confusion, or changes in the mental awareness may be the other symptoms in the pneumonia. So the signs and symptoms vary from according to the severity of the disease, and it may be from the mild pneumonia to the severe pneumonia. So various types of the factors are there which affects the types of signs and symptoms in the pneumonia. So one is the type of germ. Is it caused by the bacteria or virus or fungus? So the type of germ affects the signs and symptoms, and the age and health. So these also impact the signs and symptoms of the pneumonia. So the mild signs and symptoms often are similar to those of cold or flu, but they last longer. Newborns and infants may not show any sign of the infection, or they may vomit, they have a fever and cough, and appears restless or tired and without energy, or have difficulty in breathing and eating. So as we told that there are different types of the pneumonia. So we will discuss the different factors or the causes of the pneumonia. So first is the bacterial pneumonia. So this is generally caused by the bacteria, that is Streptococcus pneumoniae. And if we talk about the Mycoplasma, so the Mycoplasma pneumonia is the organism which can cause the pneumonia. The fungus can also cause the pneumonia, and it is most common in people with the chronic health problems or the weakened immune system. So in people who have inhaled the large doses of the organisms, and the fungi that cause it can be found in soil or in the bird droppings, and it vary depending upon the geographic location. Okay, so the location where the fungus are in higher amount in the environment, there the chances are higher of producing the fungal pneumonia. So viruses can also cause the pneumonia, and some of the viruses that cause colds and flu that can cause the pneumonia, and the coronavirus 2019, that is also known as the COVID-19, it can also cause the pneumonia, which it can become severe if it is not treated, or if the immune system is weak. Okay, so how to diagnose that, and how to diagnose the pneumonia? So the symptoms, the medical history, like whether you smoke or whether you have been around the sick people. um, First it was asked by the doctor, if if is it there, then there may be chance that you have infected with the some microbes that can cause the pneumonia. Then physical examination is there, the cracking, the bubbling or rumbling sounds when you breathe in. Okay, so this is the physical examination. Then the sputum and blood test to look for the presence of the infection. Okay, so the microscopy may be done with blood test or the sputum test. Then the chest X-ray is very helpful in this case, and this is used to find the infection in your lungs and how far it's spread. So the percentage of the infection can be diagnosed using the chest X-ray. Then oximetry to measure the level of oxygen in your blood, and that is very common nowadays. You have the oximeter, and you can measure the level of the oxygen in your blood. So before talking about the treatment, we will talk that what are the prevention, how to prevent the pneumonia. So first is the vaccination is there. So the pneumococcal conjugate vaccine, PCV13, and the pneumococcal polysaccharide vaccine, PPSV23, protects against the pneumococcal infections. Then specifically for the coronavirus, there are three vaccines in the country now currently. One is the Covaxin, then second is the Covishield, and third one is the Russian vaccine, that is Sputnik. Okay, so these vaccines can be used to protect or to prevent by the pneumonia caused by the coronavirus. Okay, so vaccine is not 100% efficient. That is, there is no mean that if you have taken the vaccine, then you will not get infected. Okay, you can be infected after taking the or receiving the vaccine, but the severity will be very less. Okay, it will not be life threatening after taking the vaccines. So the another prevention technique is the good hygiene. Maintain the good hygiene. Then stop smoking. Smoking damage your lungs, the natural defense against the respiratory infections, because the lung naturally can clean itself, but if you smoke, the elasticity of lungs will go, and your lungs may be weak and may be more sensitive towards the infection. Then good immune system. So you should take the healthy diet. You have to be physically active and take a good sleep to increase the immunity. Then the treatment. So if you have the bacterial pneumonia, first of all, the pneumonia, the treatment of the pneumonia depends on the type of the pneumonia you have. Okay, so for the medications, if you have the bacterial pneumonia, you will be prescribed the antibiotics for that. Okay, so it is important to take all the antibiotic until it is gone, even though you will probably start to feel better in a couple of days, because if you stop, you risk having the infection come back. and you increase the chances of the germ will be resistant to treatment in the future. So typical antibiotics do not work against the viruses. If you have the viral pneumonia, the doctor may prescribe an antiviral medication to treat it. Sometimes though symptoms management and rest are all the needed. So in the viral infection, you have to take the rest, okay, and you have to take the drink the lot of fluids or plenty of water, and if it is in the severe condition, you have to be hospitalized to treat the condition. So that was all about the pneumonia, and in this lecture we have studied we have discussed that what is the pneumonia. It is not the causative agent is not a single microbe. It may be the virus, it may be bacteria, it may be fungus, it may be mycoplasma. Okay, so the whatever the infection is there, but it infects the lung. So that is the main important thing. Okay, sign and symptoms, again it vary according to the severity of the disease, and the sign and symptoms again they are affected by various factors like the type of the germ, the age of the patient, and the level of your immune resistant. Okay, your health is also affects the sign and symptoms. Then we have studied the causes, specifically the viruses, and we have talked about the prevention, the vaccination, the hygiene, good hygiene, stop smoking, and maintain good immune system. And we have already we also studied about the treatment part. If it is the bacterial pneumonia, you have to take the antibacterial medicines. If it is a viral pneumonia, the doctor will decide the medicine. It can give you the antiviral drugs, or you can manage it yourself itself. Okay, the medications is not necessary in the if it is the symptoms are mild. You have to maintain your body temperature by the different drugs, and you have to take the rest, the plenty of fluids you have to taken, and follow the instruction given by the doctor. Okay, so hope you are satisfied with this detailed session, and if you have any doubt, any query, you can write in the comment box. And this session is powered by Digital Version 2, Jyoti Vidyapeeth Women's University, Jaipur. Thank you.